high in the saddle, nothing else matters. My feet in the stirrups, I'm so happy. There's nothing like the sound of Carolina hoofbeat.
Hi, we're here today in Raleigh, North Carolina at the North Carolina State University College of Veterinary Medicine. You can see behind me this incredible skeleton. So this is the place where all of the students learn how to fix horses. So we're going to take a tour of this facility. We're going to see what they have to offer us and we'll learn what's on the horizon for this incredible school. With me now is Callie Fogle. And Callie, what exactly is your position here?
So I'm an equine soft tissue surgeon. So I do soft tissue surgery on horses. And basically the best way to understand that is that I do surgery for anything that a horse presents for, that except for things like lameness. So any other types of surgery, abdominal, upper respiratory, things like that. So that's kind of my role here. I also do, as do all of the faculty here, a lot of teaching. We teach veterinary students and we teach young veterinarians who are interested in becoming specialized, such as I am in surgery.
Okay, and how many patients do come through the school or the hospital a year?
We see more than 1,000 horses per year here at the veterinary school, and they come here for these specialized services such as my specialty, which is surgery, but also orthopedic surgery, medicine, equine theriogenology, which is reproduction, equine imaging or radiology, and as well as many other specialties.
So do I have to be referred by my vet to come, or can I just choose to come here first?
We do operate as a referral center because some parts of the state, specifically North Carolina, are underserved by veterinarians, especially large animal veterinarians. There are parts of the state that sometimes don't operate on a referral basis. So because they may not have a large animal veterinarian or can't get a large animal veterinarian out in time of emergency, often those patients will see us without a direct referral. But most of the cases we see here are on a referral basis, meaning that their veterinarian would identify a horse as having a very difficult problem or a problem that requires special imaging or a special surgical procedure, and then their veterinarian would refer them to us.
So after the horse comes in and you do the intake, then how is the team? Do the students treat the patients, or how does that work?
Yeah, so you're usually, when you bring your horse here for treatment or workup at the veterinary school, you're greeted usually by one of the technicians on the team. So each service, surgery, medicine, theriogenology, each service has a kind of a team associated with one of the technicians who will take a temperature as part of our infectious disease control process, and then we'll lead your horse off. We usually weigh it here on the scale. It's a generous donation by a client, and then we will proceed into either one of our exam rooms or in a stall if we have to wait on availability. So the team of people that would be associated with your horse's case would be a senior clinician, which would be a faculty member, so they have board certification in a specialty that hopefully is very important to your horse's disease. And then there would also be a clinical technician specific for that service, a house officer, which is usually an intern or resident. So those are people that have finished their Doctor of Veterinary Medicine degree but want to become boarded in a specialty such as I am.
Okay.
So they're in training but still veterinarians, and very good veterinarians. And then we also, part of the team is the students. So this is where fourth year students really take what they've learned in the classroom and apply it to clinical cases of equine disease, equine lameness, things like that. This is where they really get that hands-on learning and seeing how we work up cases and what we do.
Okay. So if my horse has an emergency and my vet tells me I need to take him to the vet school, which often happens, what happens then?
So a lot of times horses that might present to us on emergency, they might present for colic or abdominal pain, maybe a laceration or trauma, sometimes acute neurologic disease, or horses that are having trouble standing up. Those types of things would be common emergencies that we would see here, and we're open 24/7 to accept those types of cases. Like I said, both from non-referral sources in areas where large animal veterinarians are hard to find or non-existent, and then also from large animal veterinarians to refer here.
Okay.
And one of the nice things about our emergency capabilities here is that not only are we open to accept those, but we are staffed fully around the clock. So we have 3 shifts of technicians that are very skilled and very experienced at monitoring horses, and they would be the ones that would watch our hospitalized cases for any changes and alert the doctors on those cases if there were some changes that made them concerned.
A great service too, because emergencies never happen 9 to 5.
No, ma'am, they do not. Yes, they happen it's usually the time the owner, it's least convenient for the owner, say
Yes.
if you're out of town, and it usually ends up being right before holidays, and yes, always.
Always. Thank you very much. So this is a typical exam room when a horse comes into the hospital?
Yeah, this is one of 3 exam rooms we have here at the veterinary school where horses would come here maybe to be placed in the stocks for something like a colic exam, or they might be evaluated here in this open space in front of me if they had a laceration. So the orthopedic service, the medicine service, the soft tissue surgery service, and the theriogenology or reproductive services all take advantage of this exam room as well as the others to examine horses that come into our hospital.
Where does our tour take us next?
This is what we call A aisle. So this is the aisle that we would keep for hospitalized patients that have very critical needs and need monitoring round the clock. So for us, that includes patients that are suffering from colic or respiratory disease. We're really worried that they may not be getting enough air and they may need oxygen. The colics often need fluids and multiple times an hour monitoring.
Okay.
So those are the types of patients that we would have here.
So like an ICU?
It is an intensive care unit aisle.
Okay.
My name is Scott Brookins, and I am the owner of Brookins Construction and MD Barn Master of the Carolinas. At MD Barn Master, we have the best warranty in the business. We have a variety of designs to choose from. Our barns are easily customizable to meet your needs. We have financing available to those who qualify. Our barns are fire resistant and they hold their value with little maintenance. Let us build your dream barn for you today.
People from around the Triangle come to Carolina Barbecue of Garner off Highway 70 because they know what they'll get. Authentic Eastern North Carolina chopped barbecue, Southern fried chicken, hush puppies, Brunswick stew, and more. But did you know that they'll come to you? For your next backyard party, company event, graduation party, weddings, rehearsals, or any other occasion, you bring the people, and Carolina Barbecue of Garner will bring the pig. Call 773-0222.
Follow me to Carolina Barbecue.
So what part of the hospital are we in now?
So this is the one of the aisles of stalls that we would house patients that are here for what we call elective disease. So these are healthy patients that have maybe a lameness, need an orthopedic surgery or an upper respiratory surgery. So overall they're very systemically healthy but have a problem that hopefully we can help them with.
Okay. And what's going on here?
So this is Stephanie Gibson. She's one of our 4th year students.
Hi.
And she would like to talk to us a little bit about her experience as 4th year student and what that means being a 4th year student, what you do, and what are some of the opportunities for equine veterinarians after they graduate.
So I'm a 4th year student here. I'm class of 2015, and our responsibilities are to do physical exams on the horses and client communication and work closely with the clinicians and the house officers and learn as much as we can fit in our brains.
So what kinds of things do equine students do after they get out?
So I have classmates that are looking into private practice. I have classmates looking into internships, which is like an extra year. You're a veterinarian, but it's an extra year more supervision to kind of hone your skills a little more before going into practice.
So what's out here?
So this is our isolation facility. This is a facility that is very separate from our main hospital, which is up the hill. And this is where we would house horses that had infectious disease, so disease that would be contagious to other horses. This is where they would be housed. So horses that have strangles is one common, equine herpes would be another one. This is the facility, or even diseases where we were maybe suspicious that was the problem, but we didn't know. So there's a very specific protocol that we have to follow whenever we have a horse. And you can see we have a horse in the isolation stall behind us here. We have the 3 separate stalls with a center kind of prep area. And one of the protocols is this yellow rope or chain that's in front of the stall. And that helps to remind us that we have to garb up appropriately. So we have to use what's called a PPE, or a personal protection equipment. And this is a suit that we have to use, as well as gown, gloves, and booties. And that helps to kind of keep us from transferring inadvertently this disease that the horse has to other patients.
So where are we heading now?
So this is one of our soft tissue exam rooms. This is a room where we would do examinations on horses with soft tissue disease, but also we would do standing surgeries here. So horses that have dental disease, upper respiratory disease. And this is Dr. Pronga, one of the other soft tissue surgeons, who would like to tell us a little bit more about the soft tissue surgery service.
Yes, so I think the name soft tissue service is a bit, doesn't really quite show you how much we actually do or what we actually do. We do everything but things that are associated with lameness, basically, and perhaps the back pain is something that the orthopedic service sees as well, but we do everything else. That includes a lot of the dental workups, teeth, sinuses, and then if you look further back, we do the abdominal surgeries, urogenital stuff, and everything that is associated with the skin that would need surgery. So skin tumors, but also lacerations.
Right.
So we really cover quite a big area.
So Dr. Pronga was just doing a standing endoscopy, or static endoscopy, on this mare, and he can talk to you a little bit about that, but then also one of our new and exciting tools that we have.
Yes. So we have these tools, endoscopes, that we use in different areas of veterinary medicine, a lot in horses. And basically there's a little camera here at the front and a light source, so we can put that in the nose, and then we can actually look at the throat area and see what's going on in there that might be bothering the horse. So we get pictures of, this is the voice box, the larynx of the horse, and an area where we commonly see problems like the roarer is where the problem comes from in those cases. That's the area that we look at. And the problem is that, as I already said, like horses have problems exercise. They don't get enough air. And very often that's only a problem when you ask them to perform. And so when we look at them when the horse is standing, we don't see what is really the problem when the horse is exercising. Right. So that it's a great tool, but it's very limited what we can do with it. What you really want to see is you want to see what is the problem when the horse is actually showing signs of, hey, I can't get enough air when you're riding me out in the heat. And now we have a new tool where we can actually do this examination while the horse is being ridden outside, and we can watch this area during exercise, which is fantastic and a very new tool that we just got here, and it's going to help us and our patients a lot to figure out what's wrong and how we can help them if they have a noise or they can't breathe very well.
Now we're going to visit the internal medicine service. So this is a service that specializes in equine internal medicine, and this is one of our specialists, Dr. Betta Broyhouse. Hi.
Hi, nice to meet you. I'm Rose Cushion.
Nice to meet you.
And she's going to tell us a little bit about the types of cases that they see on the internal medicine service.
Okay.
Basically, we see two main types. We have elective cases that come in usually as an outpatient. That means they come just for the day to be worked up, and then they go home for their regular veterinarian to treat them.
Right.
And then we see emergency cases. So for the elective type cases, the kinds of cases that we often see are common things would be horses might come in to have their stomach scoped to see if they have ulcers. We may have a horse that needs maybe some advanced respiratory workup, like a bronchoalveolar lavage or a transtracheal wash to culture to see what kind of organism is causing a pneumonia. But the horse is not so severely ill that it needs to stay here to be treated.
So you treat foals and right on up to grown horses?
So in our emergency, usually with the foals, yes, we absolutely see foals as well as adults. With the cases that we see on an emergency basis, probably the most common thing we see are colics. And we see both the medical and the surgical colics. And so we usually, we work as like a triage service to work the case up. If it needs to go to surgery, it goes to surgery, and then we take the horse back and do the aftercare. But another big, especially this time of year, we see foals.
I'm here with Dr. Lauren Schnabel, who's one of our equine orthopedic surgeons, and she's going to tell us a little bit about what the orthopedic surgery service sees here and a little bit about some of the newer tools that they have for evaluating lameness in horses.
Yeah, so a lot of the cases that we see come in for lameness evaluation. This is one of the tools that can really help us evaluate a lameness. It's called the lameness locator. It uses a sensor-based system that you can see on top of her head, on her right foot, and then on top of her rump. And it's much like kind of the Wii game system, so it can track their movements and search for any asymmetry, and it can also put a value to that, which is very helpful for when we block them or numb an area to figure out the source of the lameness. So that's a very valuable tool. And then once we've located a lameness, and we have various ways that we can treat them, a lot of them do involve a surgical procedure like scoping a joint or an arthroscopy, but also a lot of what we do here involves regenerative therapies, including stem cell treatments, which I grow the stem cells in my laboratory across the street, or also platelet-rich plasma and IRAP for joints. And then we're also focusing on building up our rehabilitation program, and some of that will be, Catherine will be trained in rehab, and then myself and Dr. Lustgarten are also doing advanced training in sports medicine and rehab.
If you're interested in a career working with horses, then Martin Community College is the place for you. MCC's Equine Technology program is the only one offered among North Carolina's 58 community colleges. The program is management-oriented with classes in breeding, nutrition, training, riding, equine health, and more. Graduates can leave MCC prepared to work in recreational and racing barns, breed to discipline-oriented farms, or assistant farm management. For more information, contact Martin Community College today.
Hi, I'm Rick Peniston. I train my horse Jake to trust me and be brave in order to face the obstacle challenges and win in extreme cowboy races. It takes dedication, hard work, and innovation to train a champion. As an attorney representing injured persons, I use the same skills to win compensation for people injured in accidents or on-the-job injuries. If you've been injured in an accident or on the job and need advice, call me. I want to hear from you.
With me now is Dr. Scott Bailey and Dr. Betsy Kaufman, and they're in the Therio department. Now, I'm not familiar with that term, so educate me.
Sure. Theriogenology is the full length for Therio, and it means the study of creation of animals.
Okay.
So Therio is animal in Greek, gen is creation of, ology, the study of creation of animals.
Very good. My favorite topic since I have a breeding farm.
Oh, well, wonderful.
So who is this?
This is Dorf. She belongs to a referring vet, and she's here to be bred with frozen semen.
Oh, very nice. So you guys do the whole gamut, collecting and freezing and insertion and embryo wash and all those things?
That's correct. We do all of it. Some of it we do in Southern Pines, and some of it we do here. We don't do any stallion work here because we don't have very good facilities.
Right.
So in terms of collecting semen, shipping it, we ship nationally and internationally, and we freeze semen. And that work is all done in Southern Pines.
Okay.
A lot of the mare work is done there because we have a herd of recipient mares. But any animal that we think is sick or that has the potential to be sick is worked on up here so that we have the full team that we can work with.
Now, when you talk about recipient mares, do you mean that they're mares that you're putting an embryo in to have a baby like a surrogate mom? Or
Exactly.
Okay.
Exactly. So we take an embryo from a mare who might be showing or her fertility is compromised for some other reason, and we put it in a recipient mare. And we have a herd of our own mares, and we also have some places that we can ship it to, and then she serves as the surrogate and carries that foal to term and delivers it.
Right. That's a really good service for show and performance horses, for certain. You hate to take them out of service for a year.
Exactly.
So are patients referred to you by referring vets like the normal part of the hospital, or can people just come and consult with you?
We're one of the few services that serves as a primary, so you don't have to have a referral to come and consult with us. And that's because oftentimes people that are doing breeding management don't have a veterinarian in their area.
Right.
However, we see a lot of referrals from veterinarians and work very closely with the veterinarians on the farms.
Okay, very good. Well, maybe we can make a trip down to Southern Pines soon and do a more in-depth look at this.
That'd be wonderful.
Thank you guys for your time.
Thank you.
Callie, this is really interesting. What exactly is the Gallop of Honor?
The Gallop of Honor was created many years ago as a way for clients to honor or memorialize their loved ones, a friend, a particular experience that they really valued here at the veterinary school. And we placed horseshoes and a little memento on the wall to help them remember that experience or that loved one. And so it's just a really good way to honor an experience or loved one that they have.
That's really nice.
So we also have, there are other ways that clients sometimes will honor or memorialize a loved one by giving back to the hospital for specific needs that the hospital has. The scale that's out front that you saw earlier, and the Bijou Library, which is an online library that veterinary students and veterinarians that work here can use. So these are equine-specific veterinary health books that help us advance the practice of veterinary medicine in horses, and this was donated by a very generous client whose horse was named Bijou.
So Callie, what is this room now that we're coming into?
This is a room where we would do ultrasound examination, so horses that are presented many times for orthopedic problems, so lameness, pain in a leg or a foot, hoof. Those horses would come here for imaging, ultrasound imaging of their leg.
Okay.
Dr. Megan Lustgarten is one of our radiologists here that has a special interest in horses, and she's going to talk to us a little bit about what she does here at the veterinary school.
Well, what we're doing here is fusion with MRI. So after a horse has had an MRI, we can upload the images into this unit and then utilize the ultrasound. So this modality, we're actually the only people that are doing this in the horse. It allows us really precise treatment of lesions. It allows us to do it pretty non-invasively, so we don't have to do incisions. We can do them standing. It's really promising for sports medicine injuries, for rehabbing and treating tendon and ligament injuries. So
okay. So Megan, what is this thing?
This is our CT for large animals, and so it has a special table on it. It's just a human CT. So the gantry, the hole that they go through, is dedicated for people. So really for the horse, the only thing we can do is going to be heads and limbs, probably up to their knees or their hocks. So we'll lay them down on this, and then they move right through the CT. We can get images and the studies completed usually within half an hour. Usually it's for bony abnormalities. It's great for skull pathology, so sinuses, teeth, knee pathology, so trauma to the knee.
Okay, very good.
We're here in front of the MRI unit here at the Veterinary College that we can use for horses, and Dr. Lustgarten is going to tell us a little bit about how we use that.
So the unit itself is run by a company called Animal Scan, who we have a great partnership with. Our unit is a high field magnet, and so we have a lot more detail than the low field standing magnets, but it does require general anesthesia. So similar to the gantry size in the CT, it's only large enough for a large human, so we're limited in what we can image, but every MRI unit is. You can only do feet, fetlocks, knees, in a rare occasion up to stifles, and then the head and most front of the cervical spine we can get as well. We get a ton of information, obviously, from MRI. A lot of lamenesses that can't be diagnosed with other types of imaging, we would send a horse to MRI.
So we have two different types of imaging here, the CT and then the MRI. What are some of the benefits or advantages to each one of those? How are they different?
So the horse has a ton of tendons and ligaments from their knee and their hocks down, and we would prefer MRI to image those ligaments. So it looks for areas of inflammation or little fiber disruption, where CT is really good for looking for bony abnormalities, so the tooth root, carpal fractures, so fractures of the knee, arthritis, things like that. But MRI is much more sensitive for tendons and ligaments.
With us now is Dean Lunn, and Dr. Lunn is head of the Veterinary School of Medicine and has the great vision for moving this forward. So you want to tell us a little bit about what the future plans are for the vet school and what's going on?
Well, there are a lot of things going on at the College of Veterinary Medicine here at NC State, Rose. I presume what you'd like to talk about are things that affect the equine program, though, most likely. North Carolina enjoys the benefit of having an enormous and successful, diverse equine industry. And the college obviously wants to serve that industry, wants to train new young veterinarians who are going to work in it and help it thrive. We also want to be engaged in new discovery or research work that's going to address real-world problems that are affecting horses. So our interests are in delivering outstanding clinical services to patients that come to our clinics, to training new veterinarians and postgraduate training of veterinarians so that they can be the very best clinicians and specialists that we need and also doing research on problems that are really important for horse owners and for horses that affect the industry and above all affect the welfare of these animals. We've got new facilities going in at this program, new faculty joining the institution. We've got the lowest cost of veterinary medicine anywhere in North America, and that's because of the support of North Carolina for our programs. And that means we're really a great place for young people to get a veterinary degree, come out with a lower debt than is possible in many other programs, and also a great choice because of the educators we have. Now, as we look to the future, we are looking for new development. Later this year, we're going to charge a group of faculty and staff in developing a plan for the next facility that we need at NC State for our equine clinic. And this may well, I would anticipate, look forward to the plan, I'd anticipate include possibly a significant reworking or revamping of the existing building, but the addition perhaps of a sports medicine facility to really address the needs of the majority, the larger part of the equine population within the state. And that'll be a big plan that'll probably take many years to fund, but it really will be, I think, critical for us to sustain our position at the front of the pack here in North Carolina.
Can you give me an example of how you're training a new vet to be ready to get out there and go to work?
We really know we want more primary care exposure. So we're developing a new program that's going to start literally just in the next few weeks, where we're partnering with a number of regional successful equine practices who are going to play a much more important role in educating our students, working with our faculty to design effective training programs that we can run out in the field. So this will put more of our students in their trucks riding with them and give the practitioners a greater role in shaping their education. Now, before the students are allowed to take that course, we're going to put them through, if you like, an equine veterinary medicine boot camp to make sure that they've got the basic skill sets for handling horses safely, for some of the basic procedures they're going to be asked to do. And we'll do that here at the college, initially actually down at Southern Pines, as we prepare those students to engage in pretty intense experiences with those local practitioners. And we also hope that's going to build the connection between our practice and our partners who are out in the field.
That sounds outstanding. For more information on the North Carolina State University College of Veterinary Medicine, you can go to their website, ncstatevets.org/equine. If you have an equine emergency, dial 919-513-6630. Are you ready for that awesome outdoor experience? An outdoor living space that can be enjoyed by all? Let the expertise of award-winning Belgard authorized contractor Harper Landscaping, serving eastern and central North Carolina, design and install that perfect space. A place to let the family enjoy and relax, a divine intervention to outdoor living. Whether it be a cookout with friends and family or an after-school hangout, Harper Landscaping can help you create that perfect space for many moments to cherish.
Riding down the trail under a big blue sky and pine trees, sitting high in the saddle, nothing else matters. My feet